Hi, Dr. John Torres here on my Daily Doc, where a couple times a week I talk about health-related issues, particularly those surrounding the pandemic and coronavirus, and hopefully give you information that you can use, that you can take away to help you, your family, your loved ones, and your community get through this pandemic sooner rather than later and as healthy as possible. And my main goal is to make sure that you understand the headlines, because often those are a sentence or two that can be confusing, maybe even a little bit misleading. But once you get down into the actual meat and potatoes of the piece itself, of the study, of the information, then it's really good information that you need to know, again, to hopefully help keep you guys healthy. And then I answer questions you might have. So if you have questions, please send them our way so I can get to as many of those as possible at the end of this. But first, let me start with the headlines. First and foremost, today, as we sit here talking about this, the FDA Advisory Committee, is called the VRBPAC, is meeting to discuss booster shots. This has been a big issue of contention since the White House last month said they wanted booster shots on September 20th, which is a few days away, and they wanted them for people starting to get them 8 months after they got their last vaccine. And so they're looking at it today. They've gathered all the data. And it's interesting because there's a little back and forth as to whether we need booster shots, and that's what this advisory committee is debating, whether we really need them at this point. And essentially what it comes down to, there's been a lot of information around the world. Israel is the prime example of using booster shots and having great success with booster shots. Other places are saying, we're getting good information that the vaccines are protecting us, so we don't necessarily need booster shots. And the FDA, these are a panel of experts, virologists, vaccinologists, the ones that really understand this data, are going to determine whether they think we need booster shots or not. And what it boils down to is essentially a couple of questions, and mainly it centers around what do we want the vaccines to do? Now, if we want the vaccines to do number one, to protect us from what I call the big three, serious illness, hospitalizations, or deaths, when you look at the data, the vaccines are doing a fantastic job, even with the Delta variant, of keeping us out of the hospital, keeping us from getting seriously ill, and keeping us from dying. Sure, there are breakthrough cases, and it is happening, particularly in older Americans, but it's not happening that much. Those are very infrequent, very rare, but it can happen. We know that can happen, but at the same time, the vaccines are giving great protection against those three things. Again, serious illness, hospitalizations, and deaths. The other way to look at it is number two, and that's, do we want the vaccines to protect us even from mild illness and possibly asymptomatic, getting no symptoms and being able to spread the virus? Is that what we want it to protect us from? Now, you have to put this in a larger context then, because obviously in the best world scenario, you want the vaccine to protect you from everything. But you have to remember, there are many people in this world, 80 million in the US, but there are millions of people around the world who haven't been vaccinated. And some of those, millions of those, haven't been vaccinated because they don't have access to the vaccines. And so looking at the bigger context, is it better to protect Americans with that booster shot from those serious, from just the mild infections, from maybe even asymptomatic infections, while they're being protected from the heavier things, that serious illness, hospitalizations, and deaths already? Or is it better to use those vaccines around the world to try and get the pandemic under control around the world? And as I've talked about many times, without the pandemic being controlled around the world, it's not controlled anywhere, including here in the US. So that's what this FDA advisory panel is sitting down today to look at, to figure out what they want to do and which direction they're going to go. Here's the way it works. This is called the VRBPAC. It's the Vaccines and Related Biologics Advisory Committee. And what they do is they sit down and they look at the information. They're going to vote today on whether they should give an approval for the Pfizer booster for 16-year-olds and above. Now, they could go a couple directions here. They could change the actual question and saying, instead of 16-year-olds, let's do it 60-year-olds. Let's see if we want them and those with prior existing medical conditions that put them at a higher risk from COVID-related issues. Those are the ones you should get the booster shots, and everybody else should wait a little bit. Or they could simply say, no booster shots approved at this point. That information then goes to the FDA. The FDA, who is run by Dr. Janet Woodcock, she's the one that makes the decision in the FDA on whether they're going to take the information from the advisory committee and agree with that, or whether they're going to go against that advisory committee information and change it to something else. This is, again, these are just recommendations from the advisory committee. They're not binding, but typically the FDA goes with what their panel of experts say. Recently, they have gone against it, but we'll see what happens here when it comes to this vaccine and when it comes to their decision today and the subsequent FDA decision that'll happen over the next couple of days. If the FDA approves vaccine boosters, particularly the Pfizer booster, which is the one they're looking at today, then what will happen is the CDC will meet their ACIP committee. Their ACIP committee that's the committee of their expert advisory panel. It's the Advisory Committee on Immunization Practices. And what they'll do is they'll sit down and they'll look and say, okay, it's been approved for 16-year-olds and above, but in our case, we want to just give it to 60-year-olds and above or 65-year-olds and above and those with pre-existing medical conditions. And we want it 8 months or maybe 6 months, depending on what they decide. That advisory committee gives advice to the CDC, and then the CDC decides, this is Dr. Walensky, she'll decide whether to go with that advice and say, yes, that's what we're recommending, or whether to alter it, change it, or completely negate that advice. And again, both these advisory panels, the VRBPAC and the ACIP, are just that. They are advisory panels for the FDA in the VRBPAC's case, and for the CDC and the ACIP's case, that advise FDA and CDC respectively, and then they can either take that advice and agree with it, or they can change it, or they can completely disagree with it. We'll find out over the next few days what direction they take with this. So it's really hard to predict which direction they're going to go here, because again, it could be one of a few things. It could be no booster shots. It could be booster shots for some people, those at highest risk, maybe the elderly, 60 and above, or those with pre-existing medical conditions, or it could be booster shots for everybody 16 and above. We don't know what they're going to say until later on today, then they'll say it. And so we'll find out for sure today what the advisory committee says, and then subsequently what the FDA decides, and then from there, the ACIP and the CDC. So it'll be interesting. And next week when I have my follow-up doc to doc, I'll let you know what the FDA decided and what that means particularly for you, because one of the things that the White House wanted to do when they first came out last month with their September 20th decision to try and get booster shots by then, is they even acknowledged that they don't have any authority to start the booster shots, but in this case what they can do is they can recommend it, and they can start the process of having those booster shots in place. Now, for those that are questioning it, the booster shot is going to be exactly the same shot you got the first couple of times with Pfizer. And so this will be the third Pfizer dose, which is called a booster shot in this case. And in that case, what they'll do is they'll go ahead and hopefully have things set up so we don't have to see those mass vaccination centers. They're now in pharmacies, they're at doctor's offices. Hopefully that'll continue and people will be able to get their vaccines, these booster shots, if they are recommended, in a more even manner, even a more convenient manner for them, and something that hopefully they do. And again, they're looking at it both on a local basis, a country basis, and a worldwide basis to try and decide that. So that's it with the booster shots themselves. Now, the other thing I want to talk about is what's happening in the world with case numbers. Now, we know case numbers here in the U.S. are plateauing to a certain extent, hoping they would have come down more, and they seem to be declining a little bit, but we're still in that 140, 150,000 patients or cases a day range. And so we know that that needs to come down even more, because if you remember, back in June, we were down to 11,000 cases, which would be, we want even less than that, but that would be something that would be very nice to have right now. But if you look worldwide, what's happening, the first time in 2 months, there's been a global decline of cases, which is fantastic. And the global decline is happening across the country, but in particularly, it's happening in areas, the Americas have the steepest decline, what I'm reading here. Southeast Asia and the Middle East are the ones with the steepest decline. But the problem is there are 5 countries that have recorded huge increases. One of those 5 countries, guess what? The United States, the US, the United Kingdom, India, Iran, and Turkey had the most cases last week. So even though things are starting to get better worldwide, there are still some hotspot areas. And then when you look in the US, I mentioned it's starting to come down a little bit, but there are some areas in the US that are still hotspots and are having issues. Idaho, the biggest example. And so that means that we still have a lot of work to do here. And we want to make sure that we get this under control. And that means the things we mostly talk about, which are, getting vaccinated, number one, wearing your mask, social distancing, washing your hands, those things that we have been talking about for the last year and a half. Those are going to continue to be important. And as far as testing, testing is one of those issues that has been kind of backburnered a little bit because of the vaccine, but it's starting to come out in the forefront on what can we do with testing, particularly in schools, what can we do with testing, particularly for travel or those types of situations. And a new study just came out, which was very interesting. Delta Airlines participated in a study along with the Mayo Clinic. And what they did is they looked at 10,000 passengers that were going either from JFK or Atlanta to Rome. And those passengers, they selected them and they had them get PCR tests within 72 hours of their flight. What they found out is when they did that, it dramatically dropped the number of people that had infections. As a matter of fact, at the time, on the average, the infection rate in the community was 1.1%, a little over 1%. For the people that got tested on these flights, the infection rate was 0.05%. So that's less than 0.05% versus 1.1%. And so that's astronomical. And essentially what it is, instead of being 1 out of 100, it was 1 out of 2,000 people that had it. And more particularly, 5 out of 10,000 people. And what they did was pretty interesting. Had them PCR test within 72 hours. If that was negative, then they went ahead and went to the airport, went through security. Once they got through security, they got an antigen test. And the vast majority of them had negative antigen tests. But the ones that tested positive, they did a rapid molecular test, like a rapid PCR test at the airport before they boarded their flight. And they said, okay, if you're negative, you can go on the flight. If you're positive, obviously you can't. And so they eliminated people that are positive. The negative ones went on the flight, and this dropped it down to like 9,800 people or so, because there were some people that were caught at the airport being COVID positive on both tests and were not allowed to fly, obviously. What happened is those 9,800 plus people that went on these flights ended up getting to Rome. They got tested again when they got to Rome. And out of that number of people, almost 10,000 people, one person tested positive when they landed. And so that's showing you how well testing can work if it's used in a correct manner and it's used in a manner that's consistent across these areas, which could give us big lessons in the testing both here in the US, testing in our school systems, testing in other areas, especially testing in areas where vaccination rates aren't as high as we'd like them to be, or vaccination rates simply aren't being checked. But again, that's a fantastic study looking at how well testing can work if it's implemented correctly. And then final thing, we are starting up with our flu season here. So just a reminder, I got my flu vaccine yesterday. Actually, it was interesting because the vaccine didn't really even feel getting the shot. Had a little bit of a sore arm for probably 2 or 3 hours and then nothing after that. I've had no side effects today. And it was like all vaccines this year are quadrivalent, meaning they're covering against 2 A strains and 2 B strains. The American Academy of Pediatrics came out and said for children, the nasal spray or the shot itself are equal. They're not making recommendations either way. In the past, if you remember, they recommended the shot over the nasal spray. This year, they're saying they're both equivalent, so just go ahead and get whatever's most convenient. But the important part is to get it before flu season starts. And there is some concern this could be a bad flu season, particularly since last year's was essentially a non-existent flu season, that this one could be bad, both because our natural immunities are down a little bit and we're not masking as much. Kids are going to school, which is a big issue. I had a doc-to-doc series last week, and kids going to school was a big concern. Dr. William Schaffner, who I did the doc-to-doc with, said, we know children are huge vector, they're huge spreaders of the flu. When they get into school and start congregating with each other, they can take it home, and so that can be a problem. And so you want to make sure you get your flu vaccine before Halloween, because if the season starts up in November timeframe, you want to be protected. And like all vaccines, including COVID, it does take a couple weeks to offer you that full protection. So I got my vaccine yesterday, which means I'm a little bit protected today, but I still have 2 weeks to go before I'm fully protected. And that means that I'll be protected as much as possible from the flu this year, as well as COVID. And like I said, we'll find out what they say about booster shots today and whether I need to get a booster shot over the next few weeks or not, or if it's going to be waiting a while. So time will tell here. But again, looking at the 3 subjects, we talked about the global decline in cases. Some areas, including the US, are still hotspots. We talked about the FDA advisory panel meeting today to decide on boosters. That'll give the FDA the advice, and then the FDA will make their decision. And then we talked about this testing on airlines that showed that it could really cut down dramatically on the number of cases that pass through and get spread to other areas. But now let me see if you guys have any questions.
Is it a good idea to get your antibodies tested to see if you need a booster if you're a senior citizen?
So the question is, should you get your antibodies tested to see if you need a booster? No. And the reason is a couple of things. Number one, if you get your antibodies tested, normal antibody testing, it may or may not look for antibodies that are specific from the vaccine. And I've had many people contact me with their antibody results saying, I went to a place and got my antibodies tested, and it says that I'm positive here. Does that mean that I had the vaccine, or does that mean that I had flu? Well, they're really hard to interpret because you have to look for specific antibodies versus whether you got the virus itself, or you have to look for specific antibodies if you got the vaccine. And they don't necessarily look for the vaccine-related antibodies, so it can offer a lot of confusion. Plus, even if they're low, they might be below a cutoff, but still at a high enough level to protect you. So the overall answer and the bottom line is no, you don't need to get your antibodies tested before you get the booster shot. If the booster shots are recommended, then you should definitely get the booster shot. And again, we'll find out more as time goes on.
When is the vaccine going to be ready for those under 12?
So when's the vaccine going to be ready for those under 12? Well, right now, they're submitting paperwork for the vaccines for 5 to 11-year-olds, and that's Pfizer submitting that. Pfizer is a little bit ahead of Moderna, and Moderna is a little bit ahead of Johnson & Johnson. If you remember back, when the vaccines first came out, Pfizer was first, Moderna second, Johnson & Johnson third for the emergency use authorizations. Well, that's the same way it's working for both children, looking at the age groups, and the booster shots. So what's happening now is Pfizer's submitting data. They think they'll have their data all submitted by possibly the end of this month. FDA will look at it and they'll decide, as well as CDC and ACIP will decide possibly in the middle of the month, but most experts are predicting this will happen in November, particularly before Thanksgiving for 5 to 11-year-olds. Now, as far as younger than that, under 5 years old, it looks like it's probably going to be early next year. So it is happening. They're doing all these studies concurrently, but some just take longer than other ones. And so we'll get there. It's just a matter of time. But the important part is hopefully by the end of the school year, all children can get vaccinated 6 months and above, and we'll find out.
Do you know or have information when Moderna will be fully approved?
So Moderna is looking at their full approval right now. If you know, Pfizer got their full approval for 16 and above. There's still emergency use authorizations for 12 to 15-year-olds, and that's because more data has to come in, and it's more data time is required, as in time after getting that last vaccine, to look at individuals in order for a full approval. And so Moderna is submitting their paperwork right now. They are typically about a month behind Pfizer as far as getting their authorizations and approvals. And so current thoughts are that it's probably going to happen later this month or early next month when they'll get full approval, and then subsequently Johnson & Johnson after that. And so that seems to be the timeline we're working on.
What about Moderna boosters? Are they available?
So right now, the only booster they're looking at right now are the Pfizer booster. And they're the ones, Pfizer is the one that's the company, the manufacturer that has submitted the data for a booster shot. And they're asking the FDA to approve this booster for 16-year-olds and above, just Pfizer right now. Again, Moderna is looking at theirs. They are typically a few weeks to a month behind Pfizer, and then Johnson & Johnson says they think they'll be submitting theirs probably sometime in November timeframe or in fall, early fall. And so that's the way we think sequentially this is going to work. So right now, when they talk about boosters, they are simply talking about Pfizer boosters. And the CDC has come out saying they do not want people to mix and match shots. If you got a Pfizer vaccine, then you should get the Pfizer booster, Moderna vaccine, Moderna booster. But they're looking at that information right now, and they have done studies. They're analyzing the data. Studies are ongoing to see if mixing and matching can help, if it makes things a little bit worse, if it makes things a little bit better. We don't know at this point. But again, up until we get that information, they want you to keep with the same vaccine that you got initially. And if you think about it, people that got the vaccine, Pfizer vaccine, they're starting to get into their 8-month point right now. Moderna still has to wait a little bit. And so hopefully by the time their 8-month point comes up, we have that information. And Moderna has also been approved for a booster shot. But again, we'll see. So the big news of the day, and thank you for your questions, are again, the booster shots. We'll know within a few hours what the advisory committee, the VRBPAC, decides. And then once they take their vote and decide to move on to the FDA will decide which way they're going to go with that, if they're going to agree with it or change their mind and do something completely different. We'll know over the next few days. And then if they agree to booster shots or if they approve booster shots, then the CDC will meet next week to talk about that as well and to recommend who, how, when, and all those specific issues on the booster shot itself for Pfizer. And then again, Moderna and Johnson & Johnson will follow over the next couple of months. But thank you very much for your time here. Thank you for listening. And I certainly hope that coming this weekend, you have a fantastic weekend. You keep as healthy as possible. You keep as happy as possible. And hopefully all of us can help each other get through this pandemic as quickly as possible. Thank you very much.